Sciatica is absolutely horrible, but not all sciatica was created equal. You've probably watched sciatica videos, you've probably gone to the doctor, tried everything, and you're still suffering badly. Well then this video is for you. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic in Lucan in Dublin, and I specialise in helping people with back pain and sciatica. Today we're talking about the worst type of sciatica. It's called radicular or nerve root pain. We're going to talk about how you diagnose it and what's the best course of action for you. So let's get straight into it. Do you have it? Here are some of the guidelines to help you diagnose this. Radicular pain is when usually the pain is a lot worse in the leg than it is in the back. Tingling, numbness or weakness is present down the leg. Pain goes below the knee. The pain is usually very sharp and sore rather than dull and vague. If that's you, a traditional exercise and rehab approach won't work as well as you would like it to, and there's so much suffering involved. Radicular pain is when one of the nerve roots in the spine are affected. Each spinal level has a pair of nerve roots, and they branch off and travel down the buttock, the legs, and down to the toes. So when an injury occurs, you can feel pain, numbness, tingling in those areas. There can be several causes of radicular pain. A disc herniation can be one of the things that causes it. A disc pressing on a nerve. But we know so many people have disc herniations and no symptoms at all. So often other factors are also involved. If a disc herniates slowly and gently presses on a nerve, and the nerve has plenty of time to adapt and the blood keeps flowing through it, it can be far less bothersome. Others get a bigger disc herniation quite quickly and it puts more pressure on the nerve root. The nerve root doesn't have time to adapt, the blood flow doesn't flow through it. This nerve can become starved of oxygen, it can become swollen sometimes, inflammation can build up around the nerve. This is a genuinely troublesome injury and can be extremely painful and problematic for the person suffering with it. There is a belief that other factors have to be present in order to reduce our tolerance, and these events then become sore. So what are these factors? Manual work, bending down a lot, driving a lot, smoking, obesity, stationary positions or a spike in manual labour, poor sleep, feeling ill, or a highly stressful time might also be the spark that ignites these issues becoming painful. Radicular pain is a clinical diagnosis, so you don't need an MRI scan to diagnose it. When someone has pain down the back of their leg and it's sharper and sore in nature than dull, aching, vague, and this can be referred pain, and the pain is worse in the leg than in the back. If you have symptoms like pins and needles, numbness, and a positive straight leg raise, where you lie on your back and lift your leg straight up, and given a sharp nature to that pain, then there's enough evidence that your pain is caused by irritation to the nerve root. It doesn't tell us the exact structure affecting the nerve, but in most instances that doesn't really matter. For radicular pain, the duration of these symptoms are difficult for anyone to change. A therapist can help you manage the symptoms so you can feel better more often and have far less suffering. This can help you live with the issue more comfortably, mainly through exercises and activity advice and guidance. Just a quick reminder that if you value a channel giving evidence-based, helpful advice for all things pain and injury, please like and subscribe. So what are your options? So with radicular pain, the pain can be incredibly debilitating, and you can have symptoms like burning, tingling and weakness. People think it's all to do with compression, a disc compressing on a nerve. And this has a role to play in most cases, but it's not the only factor contributing to pain. Some MRIs won't show compression on the nerve as being the relevant factor, and this can leave people feeling lost. The nerve itself can become unhealthy, it gets irritated. So surgery isn't the only option for people. What surgery often can do is help in the short and medium term with pain and symptoms. But at the 1 year mark, the results of people who have both had surgery versus managed it conservatively are the same. The natural history is favourable for most people, so most people get better over a year regardless of what you do. But that is a long time to be suffering with this. There are approximately 13% of people who are no better after a year. Trying to predict who these people are. Pain over 6 out of 10, pain below the knee, a loss of sensation, and having a big effect on work and home life. Okay, it sounds all negative. So what can you do? Injections and medication, what do the NICE guidelines say? It's perfectly fine to try an injection in an acute flare-up of nerve root related sciatica. Instead of waiting for weeks and seeing how symptoms develop, getting an injection early can reduce the short and medium-term suffering for some people. So injections are more effective done earlier. While they will help some people with their symptoms, they won't have any effect on others. The evidence for medications helping with radicular pain aren't good at all. The common medications don't work for the majority of people suffering from radicular pain. What about surgery? While surgery for the vast majority of low back pain isn't recommended at all, it is recommended for radicular pain. Like injections, it works best when prescribed earlier, before the 6-month mark would be important. And the long-term effects at 1 and 2 years show no difference than managing this with exercise. But it can help with suffering in the short term, and if it's in that earlier stage, I would really recommend you try and get it done. Structured exercise is better than general exercise. General advice to stay active. The exercise doesn't have to be overly specific, as in targeted at that area. Doing general strength training can be more effective than a class full of very specific exercises. People who see a physiotherapist do better than trying to manage this themselves. The key point seems to be that people do things that gives them some control over their journey. An exercise routine that they can do without any aggravating symptoms, and one that might provide some short-term relief, is really beneficial. Rather than just passively waiting for this to go and being a passive drug taker, finding a therapist who understands your issue, has comprehensive knowledge around radicular pain and all the treatment options, and having a plan you can work on are the key ingredients in managing this condition. To summarise, this issue is also going to demand daily attention from sufferers, and it requires a lot of mental and emotional flexibility and resilience. Flare-ups happen, and that might disrupt someone's life for a few days. Some people will have to pace themselves even in their household and daily tasks. As I've said, try to keep moving and engage in general exercise. I have some sample exercise programs done for you, and you can see these here. If you have any questions, please feel free to reach out with any questions you have by commenting below.